Hi guys! Welcome back to my channel. This is Brand Damage. Kumusta kayong lahat? Sana ay nasa mabuti kayong kalagayan. So kakaiba ang gagawin natin ngayon. Magkakaroon tayo ng reaction. Last night kasi may napanood akong video about a Filipino nurse who is actually working in Canada. In-interview siya for the school that she is representing. Medyo naging viral lang yung video na to kasi medyo marami ang negative reaction. It's all about the Filipino nurses. So ang gagawin natin ngayon, mag-share ako ng aking personal opinion based on my personal experience as a nurse. By the way, I graduated as a nurse in one of the universities in Manila. And then after that, I worked in one of the hospitals in Manila as well for 7 years. Currently, I am working as a nurse here in Dublin, Ireland. So guys, tara sabay-sabay natin panoorin yung video na nagiging viral na ngayon. Alright? So guys, samahan niyo ako, pakinggan natin yung interview and then we will give our personal opinion and comments on the video interview.
What's the difference between a registered nurse in the Philippines and in Canada? Number one, the professional communication. In the Philippines, we rarely speak to our patients, we rarely speak to our colleagues, and more so with doctors. Like they are so high up there that we do not communicate to them.
So, sabi niya, we rarely speak to our patients, to our co-nurses, and especially to the doctors. I just disagree with that because isa sa mga natutunan natin during our college years is when we first encounter or when we meet our patient is to establish rapport. What is the importance of that? We want to establish a trusting relationship with our patients. Sabi niya, we don't talk to our co-nurses. During my time when I was working in the Philippines, sobrang stressful ng trabaho natin bilang nurses. And it is important that we have someone to talk to during our duty. If our patient is deteriorating, kanino mo ba unang sasabihin yun? Siyempre sa kasama mo, especially yung senior staff nurse na kasama mo. And then, ang sabi niya, we don't talk to the doctors. That is not possible, especially for us nurses, kasi kailangan nating makipag-communicate sa mga doctors in order to implement the treatment plan for our patients. Communication is one important skill that we need to develop as nurses.
But in Canada, you really have to speak up. You really have to be very assertive on behalf of your patients. You should be confident enough to speak to a doctor, to your colleague, if your patient's safety is at stake. So another difference that I'm going to tell you is the skills in assessment. I know we studied this, assessment skills while we were students, but my question to you, IENs, do you get to practice that? I doubt. Why? Because in the Philippines, we have interns, we have residents, we have doctors, we have students, and so you just look at the chart and they will document their complete assessment of the patient.
So sabi niya, isa sa mga natutunan natin during our college years is how to assess a patient. And based sa kanyang interview, ang sabi niya, nurses in the Philippines daw ay hindi nag-a-assess kasi umaasa lang tayo sa mga interns, sa mga residents. Maraming mga interns, residents sa hospitals. But it is not a reason for us not to do our nursing assessment. Say for example, during the night shift, usually konti lang ang doctors na nag-duty. One of your patients is complaining of difficulty of breathing. And syempre, hindi mo naman pwedeng basta-basta mapapapunta yung doctor doon kasi marami rin siyang ginagawa. So we have to assess the patient first. And before ka mag-refer sa doctor, you should have assessed your patient. Tatanungin ka ng doctor, nahihirapang huminga, ano yung O2 saturation, ano yung respiratory rate. So we have to know that. And how do we know that? That is by doing nursing assessment on our patient.
So we do not complete it at all without practicing your skills in assessment. How comfortable are you assessing your patients and finding out what's wrong with your patient? That's a huge difference between in the Philippines and in Canada. Stanford College, we prepare you for that NCAS assessment because we have a lot of practice scenarios. You can see the laboratory and my back. You get to practice back those skills again You have to be confident enough, okay? So that before you even schedule for that NCAS, you are so confident that you can do it. Another difference, of course, now in the Philippines, we work anywhere. Okay, this time you work in ER, next month you work in another department. Well, it's kind of different in Canada. Why? Because in Canada, you need to specialize in areas. Like for example, even before you can work in emergency, you have to go and study and complete your specialization before you can even work there. Why? Patient safety.
Okay, so yung sinasabi niya naman dito is nurses in the Philippines daw can work anywhere dun sa hospital. She's actually referring to the different areas in the hospital. Well, based on my experience, there are times na ipupull out ka sa ibang area. Like for example, I was working in the medical surgical ward, and then there was this time na sinabi na I need to go to emergency room para ma-pull out kasi nga kulang sila doon. We can't really avoid that sa hospital, especially in the current situation right now. Sobrang kulang ng staffing ng mga nurses. However, if ever na ipupull out ka sa isang area, dapat kasama lagi ng senior staff nurse doon. Nangyayari yun in the Philippines. And I think that is one aspects in the healthcare delivery in the Philippines that needs to be addressed.
And of course, we want that at the topmost, patient safety.
Yes, I agree with that. Patient safety is our number one priority.
And we have to be confident in what we are doing. Again, the machines are not the same here in Canada compared in the Philippines. Or maybe we have less machines there. I remember when I was a student, we're using a ruler to measure the CVP. And then when I started working in Middle East, oh, so there's an actual CVP.
So, sabi niya dito, nung student daw sila, I'm not sure what year is that. Siguro medyo matagal na. But for me, based on my experience, meron namang mga CVP monitoring device na nagamit kami sa hospital kung saan ako nag-work. Ito yung tinatawag na manometer. Siguro nung panahon niya, wala pang manometer noon.
So imagine those. And I even worked in UAE wherein everything is disposable, everything is in a kit. In the Philippines, we have to gather everything. Oh, I need this one, I need this one. No, you don't even have to worry about that because in Canada, we have everything prepared for you. But you have to be familiar and confident in what you do.
So yun, kinumpare niya ang Canada and UAE sa Philippines, which is unfair kasi magkaibang bansa yun eh. Sobrang advanced ng UAE and Canada, especially if she is referring to the time when she was working in the Philippines. Alam naman natin ang Philippines is a third world country. You won't expect na kumpleto talaga ang gamit natin sa Pilipinas.
So, for example, another big difference, you are about to start an IV to your patient, okay? In the Philippines, you don't even explain at all. You just tell them, okay, I need to start IV. That's it. Here in Canada, you cannot do that. You will have to ask for consent. You will have to assess, as in assess. And if you believe, okay, even there is a doctor's order for that IV insertion, you believe that there is no benefit to your patient, you get to question the doctor. Doctor, I don't think there is a need for IV for this patient at this moment. And this is invasive. I'm giving pain to a patient. Why do I have to do that? So you have to be that kind of confident in behalf of your patient.
Meron siyang dalawang sinabi dito. Ang una niya sinabi is, we don't talk to our patients. Ang sabi niya, hindi daw tayo humingi ng consent, which is not true. We can't do any procedure to our patient na tumatanggi or ayaw nila. I myself would get consent from my patient, even just doing IV cannulation. Siyempre, tatanungin mo, Ma'am, sir, pwede ho ba akong mag-insert ng IV cannula kasi mag-start kami ng antibiotics? And also, magtatanong yung pasyente sa'yo. Siyempre, we have to answer them. And pangalawa, ang sinabi niya, kapag daw may in-order yung doctor, sunod lang tayo ng sunod, which is not true. We really have to speak in behalf of our patients. That is one of the roles of nurses, being a patient advocate for our patient safety.
So that's a huge difference again. Do you think you can do that? With Stanford, we will help you prepare to become a confident and assertive nurse. So again, going back to NCAS, you will be given 4 different scenarios. 2 with actual patients and 2 with mannequins. How comfortable are you dealing with actual patients and with mannequins? And it's not just plain mannequins, it's called high fidelity mannequins. For example, they will ask you to listen to the breath sound of the patient, so you will be using your stethoscope, and then you will have to tell them, what are you hearing? They can change that. They know if you're telling lies or if you're not correct, because they know they will set what you were about to hear. So here, with our mannequins here at Stanford College, we will train you, okay? As I mentioned, the skills in your physical assessment, you are going to go back to that, okay? You will get to practice a lot with our actual patients, okay, with each other as a student, and of course with mannequins, so that you get to be prepared when you are about to take your NCAS.
Okay, so dyan na nagtapos yung interview ni nurse from Canada. So after listening to the interview, meron akong mga points na I would like to discuss. Number one is, lagi niyang kinukumpara ang Philippines and Canada, which is really unfair because alam naman natin Canada is a first world country. In terms of healthcare, mas advanced talaga ang Canada. Then the Philippines is still struggling in terms of healthcare system. And I think isa yun sa mga kailangan nating improve. My second point is, based on the interview, she's actually promoting yung school kung saan siya nagtatrabaho. And wala namang masama doon. The only thing is that the interview was done in a bad light. So ang nangyari, in order to promote yung school, she went to the extent of throwing insults to our Filipino nurses. I know a lot of Filipino nurses are really hurt and are really sad when they saw this interview. Siguro kung ang ginawa na lang niya is she emphasized the strengths of the school. Like sabihin niya, advance ang mga gamit nila. The mannequins they're using are very advanced. Maybe she should have focused on the strengths of the school rather than throwing insults or degrading another institution or another country. And my last point is, she actually insulted a lot of Filipino nurses in the world. Filipino nurses are one of the best nurses in the world. They are naturally caring. Marami silang alam. Ang dami mong matututunan talaga kung ikaw ay nagtrabaho sa Pilipinas. Siguro kahit saan ka ilagay sa mundo, kung galing ka sa Pilipinas, kahit saang parte ng mundo ka isasabak, kakayanin mo kasi magagaling tayong mga Filipino nurses. Maganda ang ating working attitude. Marunong tayong makisama sa ating mga katrabaho. I hope this one would be an eye-opener for all of us. Okay, so that would be our reaction video. So that's all for now. I hope you enjoyed the video. I hope you learned something out of the video. And once again, this is Brand Damage. Don't forget to like and subscribe to my YouTube channel. I'll see you again on my next video. Bye-bye.